The basic structure of psychotherapy. In this video, I'm going to present to you a simple but comprehensive model, a way to understand the basic structure of the psychotherapy field. There are three pillars of psychotherapy practice, those being the basic therapeutic approaches, the so-called common factors and associated therapist practices, and the symptomatology or diagnostics of psychotherapeutic practice. Starting with the basic therapeutic approaches, there are 7 classic psychotherapy traditions, and each one is oriented around a different human function. That's why you get those 7. And I'm going to list them for you. We have the psychoanalytic, the cognitive behavioral, the existential, the systemic, the somatic, the transpersonal, and finally the expressive. Now, those are 7 broad psychotherapy traditions which we can further subdivide each one into 2 sub-traditions. And then we can understand how these therapy traditions relate to one another by plotting them on this chart that you see right here. Okay, we plot the traditions from the more physically oriented on the bottom of the chart to the more mentally or spiritually oriented up top. And those subdivisions that I mentioned, we end up getting one subdivision that's more inwardly focused on the interior of the person, and the other subtradition is more focused on the relationship between the person and the outside world. And so you end up with these 7 pairs of traditions, which give you a variety of approaches, different kind of angles on problems, and it's useful, in my view, to train in all of these different approaches, because what works well for one person won't necessarily work well for another. Now I'm talking clients in therapy. And what works well for someone at one point in time with this given issue doesn't necessarily work well at another point in time or with a different issue. So being broad-minded, in my view, is a good way to do as effective work as you can, as opposed to being locked into one single angle of therapeutic approach. Okay, now we want to look at the common factors. Now these are, we could think of them as the sort of basic skills of therapeutic practice, and these are important no matter what the particular approach may be, and that's why that's called common factors. This is what therapists have been found to have in common when they're doing effective work. And we can also look at 7 basic common factors. They're not tightly associated, by the way, with the therapy traditions in terms of who formulated these principles. There's a loose association, at least with a couple of them. But the 7 basic common factors would be the alliance, confidence on the part of the therapist, the issue of catharsis, empathy, insight, framework, that the therapist has a framework and is socially sanctioned, and finally modeling. The therapist models certain things that its client ends up absorbing in various ways. Okay, and then we can look at a chart for these too to understand why you have these 7. And can think in terms of pairs of common factors as well. And you end up with this chart with their associated basic therapist practices, which are, again, like I say, the kind of basic skills of a therapist, regardless of what particular approach they may be using. Okay? And that's the common factors. Now, let's talk a little bit about the issue of symptomatology or diagnostics in therapeutic practice. And this is the kind of, you could say, like sort of medical science aspect of doing therapeutic work. Here, we can think in terms of 11 basic symptoms as with their associated syndromes. A syndrome is just kind of a constellation of symptoms. And diagnosis in therapy, psychological or psychiatric diagnoses in general, it's important to be clear. These diagnoses are syndromal. So they don't explain things the way that, say, a diagnosis of a viral infection explains the symptoms of a cough and sore throat. The psychiatric diagnoses are syndromal. They are merely naming, really, the symptoms or the symptom cluster. And that's very important to understand. But knowing about these symptoms and what therapists have learned about the syndromes over the years can be very useful, both in terms of understanding what client's trying to convey to you and also knowing what's likely to be most helpful with respect to any given syndrome. So the 11 basic, and these are kind of cardinal symptoms with respect to these classic syndromes, are anxiety, paranoia, self-inadequacy, depression, negativity, lovesickness, self-doubt, pathological guilt, alienation, dissociation, and social awkwardness. Okay? And then these we can plot also on a chart. It looks a little bit different than the first two charts we used. But here we're plotting on a chart. Again, the up and down axis is from more physical on the bottom to more mental or spiritual up top. And then the left-right axis here, the ones all the way on the left as you're looking at the chart are more receptive orientations. The energy is, you could say, sort of incoming with respect to the person. And on the right, it's the more kind of outputting type issues. Okay, the ones in the middle are sort of balanced between those two. And this ends up being a way to understand human character. Here it's from the pathological side of things, but you can also then look at the positive side of things. And so here you see the basic strengths of human character that are associated with those symptoms on the negative side. But this is the positive side of things, and I think ends up being very important, because one of the ways we help clients is by tuning them in to their strengths, right? Whether we're doing that explicitly or implicitly, it's an important part of the work that we do. So that gives you a basic understanding of the basic structure of the psychotherapy field. If you're interested in this material, perhaps you might like to subscribe to this channel, because the videos I make go into details with respect to all of these different elements. Okay, so hope you've found it interesting, and thanks for watching.